Good afternoon. Happy Sunday. Dr. Barry G., your Houston's dancing psychiatrist, here to talk with you all about supplements. My patients know that I frequently do talk about risks and benefits associated with supplements. There's a natural assumption to think that supplements are natural, they're safe, they're over the counter, so they must be safe, right? Not necessarily. Medications that I prescribe, they have risks and benefits associated with it, and so do supplements. The only thing about supplements is they're often less well studied than the medicines that I do prescribe. At least medicines that I prescribe have to undergo rigorous FDA testing to show risks and benefits and safety. Supplements do not have the same criteria. And the level and bar that they have to prove often is not the same. So I do want you all to remember that, number one. Supplements can have benefits, and I do take several supplements myself, but supplements can have risk, and I'm aware of that when I take that. I am aware that what I am taking has potential benefits and potential risks. Unfortunately, when you see commercials or ads, they list all these positive things in big bold letters or in loud volume and slow volume, and then they talk about potential risk factors or the fact that it's not meant to treat any disease state in little letters, in small writing, or they speak really fast like that so you can really understand what they're saying, which really annoys me because it's deceptive. It's very deceptive. I read a really interesting article this morning in a journal that I read a lot and talked about the FDA recalling two supplements because of potential medical danger. One supplement the Food and Drug Administration pulled was a product called Modern Warrior, which was being marketed as a dietary supplement that could help reduce cravings for food, boost metabolism, and improve brain function. That all sounds pretty good, right? But it was found that indeed in that product, there were two products that were potentially dangerous. One was a product called tianeptine, Tianeptine, and that product actually is not FDA approved for medical usage, and there was evidence to show that it may cause suicidal ideation in children, adolescents, and young adults aged 25 and under, and thus was taken off the market for that reason. Number two, there was another product in that 1,4-DMAA, which is an amphetamine derivative that was associated potentially with heart disease. So once again, two things you formerly could get over the counter, safe, right? They must be, they're safe, they're over the counter, but actually had ingredients in it that weren't potentially safe. And that's really what I talk with you all about. Sometimes supplements, you're not just getting that supplement, you're getting other ingredients that your body doesn't want and that you don't think you're getting. And that could be potentially problematic. Once again, I do believe in supplements that have undergone rigorous testing, and supplements can have benefits, but they can have risks. Another example that this article talked about was a product called Silantan, Silintan. And that was another supplement, and that was a supplement that was being marketed as a non prescription medicine for joint pain and arthritis. Very common, joint pain and arthritis, a non prescription approach. But actually, this supplement was found to contain meloxicam. Meloxicam, for those of you all who don't know it, is actually a prescription medicine that can help with joint pain, anti-inflammatory functioning, but in excess levels can cause drug-drug interactions with the medicines that I, as a psychiatrist, prescribe, and also can be associated with life-threatening events such as heart attack, stroke, blood clots, so not necessarily a benign product. So these are things to think about. Once again, not saying that all supplements are the same. There are agencies that actually monitor supplements and that actually grade supplements as pharmaceutical grade from the standpoint of safety. There are agencies that look at supplements and do rate their safety, and you can look at that and get a better feel for that. But what I want you to remember is supplements have potential benefits, they have potential risks, and since I'm all about mental wellness and health, but it's both mental wellness and physical wellness, I want y'all to keep that in mind when y'all take a supplement. Do your research, do your due diligence. Just don't take the fact that it's available over the counter as evidence that it's safe. With that being said, please press that button and subscribe. This at Barry Gritz, Houston's dancing psychiatrist, and I hope you guys have an amazing day. Take care.